Good afternoon, everyone. Welcome to day 6 of the Ontario Coaches Conference, and today's session, all on the topic of modifying training around injuries. A few housekeeping items for you before we get started. This session will run about an hour until approximately 2:30 p.m. Eastern. You may use the public session chat on the right side of your screen to ask questions, and I'll be collecting those to be read at the end of the presentation. If you have at any time you need assistance, you can contact the CAO team by using the chat box on the left side of the screen that says Contact the CAO. Today's session is being recorded and will be available for you within about 24 hours from the Sessions tab on the left-hand side. So today we are excited to bring you Amy Stefanik, a certified athletic therapist with the Canadian Sport Institute of Ontario. She's the lead therapist for Rugby Canada's Development Academy program, which is a U18 program for both the Rugby 15s and 7s programs, having attended the Youth Commonwealth Games in 2007 and Youth Olympic Games 2018. So please join me in welcoming Amy Stefanik. Over to you, Amy.
Thank you for that introduction. Again, I'll just be repeating just some bits of that. So I work at the Canadian Sport Institute of Ontario, which is located in the Toronto Pan Am Centre, which is in Scarborough, Ontario. The Rugby Canada Development Academy is a high-performance program working with the next generation of rugby players. So typically our age range is going to be high school athletes. So our agenda for today, we're going to be looking at defining injuries in sport, the effects of injuries on an athlete, how to keep athletes engaged in sport, tips on how to modify training for injuries, managing the training loads for when the athlete is returning to train or returning to play, and then lastly, the roles of an athletic therapist. So what is an injury? The IOC's definition of an injury is tissue damage or other derangement of normal physical function due to participation in sports resulting from rapid or repetitive transfer of kinetic energy. An injury can either be acute or chronic. So acute is a sudden onset. So for example, a muscle strain. And then your chronic injury is usually a gradual onset, such as a tendinopathy. An injury can result in contact, non-contact, or overuse mechanism. So contact can be either from contact with the ground, contact with an object or an opponent. Non-contact can be examples of running, jumping, change of direction. And overuse is usually from a repetitive activity. So throwing, serving, running. An injury can result in an athlete being fully removed from play. They can be treated but have a modified training plan, or it can be fully training but still require treatment. So the negative effects resulting from an injury. The physical. So being removed from the sport, muscle loss and therefore strength loss, conditioning and skills deficits, and then even potentially does not return from sport because of an injury. The psychological effects. An athlete can feel that they have a loss of identity because they just know themselves as an athlete, a loss of control. They can be withdrawn and then eventually also feeling depressed. The emotional effects resulting from an injury, increased stress and anxiety, the fear of missing out, fear of losing their position on the team or maybe the starting lineup, and then fear to return from sport because of the injury or fear of re-injuring that specific injury that they currently have. And your social, they might feel isolated or they might isolate themselves from teammates because of the injury. And as well as they might feel like they're missing out on team events if they're not healthy and training with the actual athletes themselves. However, there are positive outcomes that can result from an injury. The physical, it gives your body time to rest. You can heal from other injuries, maybe lingering injuries that you've had from the past. You can focus on strengthening your whole body, maybe working on mobility that you previously don't have, and then just refining your skills of the sport. Psychological, so you have time to reflect. You have an outside view during practices in games, and then as well as you build resiliency. The emotional, you end up figuring out that how to overcome this injury. So with hard work, determination, making new connections, maybe with other athletes that are injured as well, other staff. You have a new outlook and appreciation for being healthy. And then social. So you end up being engaged in other roles while injured. So maybe you'll take on more of a leadership role. You have time to work on other activities. So this can be outside of sport, maybe focusing more on your education. And then as well as developing relationships with medical staff so that you can develop that trust. So next time, if something does occur, you feel confident and you have that trust with the medical staff that you can come to them with anything, even if it isn't related to an injury. So keeping athletes engaged while injured. So you want to set personal and performance goals. So personal, for example, could be increase confidence in their left-hand passing. And then performance can be improve shot accuracy. You want to give the athlete other team tasks and activities. So for example, they could be setting up cones during practices, reviewing game film, helping teammates that may be in the same position as themselves. So if this athlete's used to being a starter and then working with that athlete that's replacing them in the lineup, just to give them some feedback. And then watching game film during rehab activities. So during this time, so for example, if you have an athlete wanting to work on their conditioning, you can put on the game film and then have them bike when they're on their shift. And then when they are off onto the sidelines or on the bench, they can slowly bike again. So you're just trying to keep them engaged into the sport, but working on that sport conditioning at the same time. Having the injured athlete continue to attend all team meetings, all training sessions and competitions. So again, it's really important to just have the athlete still feel like they're an equal part of the team, even though they can't necessarily participate into training or games. And then have an injured athlete train in the same training environment and during the same time as all the healthy athletes. So again, this can be, for example, during team lifts, having the injured athletes perform their rehab exercises or their modified program the same time as the healthy athletes. This allows for the injured athletes to look forward to their return, seeing that what their teammates are doing, and then they have those goals to get back to what they're doing. But also it shows the healthy athletes how hard the injured athletes are working and their progress as well. Okay, so first we're going to start about how you can modify your training around injuries. So first you need to identify the following. What structures are injured? So for example, is it a muscle injury, bone, tendon, cartilage, ligament, etc.? The severity of the injury. Is it a grade 1? Is it a grade 2? Is it a full rupture? Are they returning from a postoperative procedure? The stage of healing. So did the injury just happen and they're in their inflammatory phase? Is it early, mid, or late into their rehab? Or are they in that portion where they're focusing on returning to play? And then knowing what activity restrictions are set in place. So with your post-operative injuries, you'll have guidelines and protocols to follow from the surgeon. So that way you have a little bit more of an understanding of what the athlete can participate in during that time. But if not, again, working with the athlete and medical staff to figure out what restrictions are set. So maybe they can do all non-contact practice, but they're not ready for contact practice yet. Okay, so how to modify training with injuries. So this is going to be from a coaching's lens, a coaching's perspective. So you want to break down the skills of your sport into simple, moderate, and complex. You want to break down the skills into stationary, dynamic, non-contact, in contact, or collision, depending on what sport you're working with. And then you also want to create different versions of your practice plan. So the next slide, I will provide you with an example. So this example we're going to be doing is basketball. So again, disclaimer, I'm not a basketball athlete or work with basketball players, but this is my best attempt at breaking down the skills. So your simple skills, you can break this down into stationary and then dynamic. So you're going to be dribbling just in one spot, passing your chest pass, your bounce pass, just in that one spot, and then as well as shooting. And then you're going to then break down that into dynamic. So you could be dribbling while walking and then while running, passing. You can have your opponent moving at first, and then you can be moving as well as your opponent, and then shooting, same thing. You can be moving and dribbling while shooting. And then you're going to be looking at your moderate, which is going to be more technique and coordination that will go into these skills. So again, this is where you have your layups, transitioning from offense to defense, jumping for a rebound. And then your complex skills are going to be more of your reactive drills. You're reacting to the external stimulus. So jumping up and blocking a shot, dunking, going around an opponent, and then as well as defending an opponent. And then our next example is going to be hockey. And now we're breaking this down into stationary, dynamic, non-contact / collision, and then contact / collision. So you're going to be starting with passing. So again, you can have the athlete passing against the boards. They can be passing with a partner. They can be work on their saucer passing. And then you'll have them stick handling. So you can work on tight stick handling, and then you can have them exaggerated from their outside foot back in. So you can change up the speed as well as the distance for the stick handling, and then stick handling around cones as well. And then we're moving more into your dynamic. So we can start with shooting in a stationary. So that just means that the athlete isn't moving from where they are. But again, we know that shooting is more of a dynamic exercise. So again, you have your options of, you can start with your wrist shot, and then you can move forward into your slap shot, and then a one-timer. And then you can have the athlete perform all those, but with movement. So they'll be skating and shooting, or skating and then receive a one-timer. And then you have skating. So again, you have your forward skating, backward skating, crossovers, etc. And then you have skating with passing, stick handling while skating, and then again, you can combine the two, stick handling while skating with passing. And then you're going to move on to your non-contact or collision drills. So this again will be a little bit more dynamic, but also include external stimulus, so with other teammates. So this will be your shooting, your deking on a goalie, your breakout drills first with no opponents, and then you can work on those breakout drills with pressure and opponents. You can work on your power play format, your penalty kill format as well. And then again, you can include opponents that are there. And then we'll move into the contact and collision drills. So these will be your battle drills along the boards, your power play and penalty kill drills, but live. So you can do your 5v4, 5v3, where they are adding the pressure and potentially the contact. And then as well as your 1v1 drills where you're taking the body, or if it's with men's hockey, you're actually completing that hit against the boards. Okay, so now it's your turn. So I want to challenge you to write these categories down and try to break down the skills of your sport into simple, moderate, and complex, and then as well as stationary, dynamic, non-contact or collision, and contact. So again, you don't have to do this now, but I would like to challenge you to try this either today or tomorrow or sometime the rest of this week. So now we're going to be looking at how to modify training with injuries from a strength coach lens. So again, especially during this time, a lot of you coaches might not have a strength coach. So maybe you're stepping into that role. This kind of gives you a better idea of how you can modify for those athletes that have injuries, but still have them participate in any kind of training. So first you want to identify what extremity, joint, or muscle action you're able to work with first. So again, you're going to want to consult with your medical staff if you do have any, or just with the athlete about what the either doctor or therapist has said that they can or cannot do. So you're going to break down your exercises into a list of progressions. So you're going to start with body weight. So examples, you can have squats, lunges, planks, push-ups, and then you're going to move on to maybe those same activities with bands, or you're going to have more of a complex exercises. So you can do your rows, your clams, shoulder rotations. Then you move into free weights. So all those activities, maybe adding weight. So you have your dumbbells, your plates, your kettlebells. And then you'll move into barbell. So that's when you're going to look at, again, more of the complex and weighted exercises, your deadlifts, your squats, overhead press, and even Olympic lifts. You're going to create a list of exercises, but in different body positions. So again, the next slide, we will show examples of this. And then again, you're going to break down those exercises into simple, moderate, and complex. So this example is your athlete is going to have a knee injury. So for example, we'll just say they've had their ACL repaired and you're able to work with the upper body. So you're going to start with your seated exercises. So this is going to be at the beginning of their rehab. They're going to be unable to weight bear. So you're going to want to have them seated, just in the most comfortable position that they can have, their legs still straight and likely their leg in a brace. And then these are examples of exercises. So having them seated, doing an overhead press, tricep extensions, your lat pull downs, your bicep curls. Then you'll be moving to supine, which is having the athlete lay on their back. So this will be when the athlete is unable to weight bear, but they can still comfortably bend their knee. So the athlete has been focusing in rehab on working on gaining the range of motion back. So when they are lying on a bench, for example, they can comfortably have their knee bent without any issues. And then upper body exercises that you can work on are bench press, we have your pec flies, your overhead raises. And then you'll be moving to prone, which is with the athlete being face down. So they'll be able to weight bear with full range of motion. So again, in their rehab, they've obtained full range of motion. So they'll be cleared to be prone. So upper body examples are your rows, maybe your shoulder tees, push-ups. And then lastly, you'll move to standing. So the athlete's able to fully weight bear, has full range of motion and strength, so they can feel comfortable and confident standing, performing upper body exercises. So this will be, you can work on your shoulder rotations, whether that be dumbbell or cables, your lateral raises, your overhead press. Okay, now we're going to move on to the athlete has a shoulder injury. So for this sake, we'll say that they've recently dislocated their shoulder, and you're going to work on lower body exercises for them. So we're using the categories of simple, moderate, and complex. So simple, you're going to look at usually single plane movements. You're going to want to eliminate unstable surfaces. And then you're going to have no weight in the injured side, and you're not going to perform any power or plyo exercises. So this is usually at the beginning of the rehab when they're removed from sport. So some lower body exercises that you can perform with them are examples of hamstring curls, leg press. You can have them do squats, lunges with the weight in the opposite hand, glute bridges. And then we'll move into moderate. So this is, you can work on 2 planes of movement. You can introduce weight into the affected shoulder. You want to avoid vulnerable positions on the shoulder. So for example, front squats or back squats with barbells, for example, that usually will put pressure directly onto the shoulder, but getting into that position might be a vulnerable position. So you want to avoid that as well. And then you can introduce them into plyos and power. So this will be at the middle of your rehab where they've returned to modified training. So for example, you'll have your Romanian deadlifts. You can do step-ups, goblet squats. So again, with the goblet squats, they're not putting their shoulder in a vulnerable position. So that can be with dumbbells or kettlebells. And then skater jumps. And then lastly, you'll go into complex. So this will be your multiple planes of movement. Your exercises can all be weighted. You're going to introduce back into Olympic lifts, again, if that's the stage where they've been participating already, depending on their training age. And then as well as introducing overhead movements again, because overhead movement is going to be one of the last ranges, or even being comfortable with the shoulder dislocation. So this will be at the end of their rehab when they're returning to sport, but they're still treating. So you can do a squat to overhead press, you can do cleans, med ball toss, sled pushes. Okay, now we're going to move into, again, because I do work with the rugby program, we're going to move into a couple of rugby examples where we're putting all of this together. This is an example of an athlete returning from a shoulder reconstruction, and they're returning to their on-field and their contact sessions again. So we've broken down the skills of rugby into specific progressions. So we're going to start with week 20. So they're 5 months post-operative. They're going to look at beginning to line out lift, which just means that the athlete is lifting a player from the ground to above head. They're going to be working on their aerial skills, which just means they're jumping to catch, to receive a kick, which is usually off of kickoff. And then into the contact progressions. So they're looking at more of their body position. So are they staying square? Are their hips forward and they're tracking their opponent properly? We'll begin to kneeling and fending, which means just a straight arm. We'll be looking at that into a bag. And then you'll be working on your ball placement. So you can, while you're on the ground, so working on that without an opponent, and then having an opponent, which could be another teammate or coaching staff, ripping the ball away from them. And then working on their body positioning for their rucks and their scrums. And then again, those will be all the skills that the athlete will want to complete in that week. So the coaching staff can then identify and try to implement these skills into their practice plan so that they can have this athlete perform these exercises with the team. And then moving into week 21 is you'll be looking at scrumming against a defender with drive, which just means you'll be moving your legs and trying to push the defender backwards. You'll be performing those lineouts with a defender. So again, there will be that contact from the defender. And then you'll be looking at doing some of your crashing into a bag or your straight arms into a bag, and then eventually moving to tackling, where you're just going to make contact with the bag, but you're actually not going to punch through and drive your feet. So again, we're really looking at breaking the skills down so that we can progress and build them up to return to contact. And then we'll just jump to week 23, where the athlete is, again, still working with the bag, but they're fully tackling the bag to ground, and then they're popping up and rucking over that bag. They are rucking and hitting the bag, and then going to be performing their leg drive, so moving their legs to get their opponent backwards. And then we'll actually have that athlete hold the bag and have their healthy athletes run into the bag, straight arm the bag, so that they are accepting that force again. So they're getting prepared to accept that load. And then you'll do your standing tackle progressions with a defender. So you'll work with making the initial contact with a defender, but you're not driving through. And then you'll be working on shoulder straight arms while being on offense with a defender. So here is an example of a rehab plan. So this is a lower body injury, specifically an ankle injury. So this is just an example of how you can break down the skills into phases. So you don't necessarily have to have a specific timeline, but knowing that you're starting from very simple, basic exercises in terms of you're combining your rugby, your strength and conditioning, and your therapy all into these phases. So again, very important to have the athlete involved, as well as giving them this program so that they know what is expected of them and what they need to complete in order to move on to the second or third phase, etc. So at the end, you can check off the date that it's completed. So for example, at the beginning, the athlete is focusing on continuing to have hip and knee strength, even though their injury is in the ankle. They're going to work on relearning how to walk again and without any compensations. So then if you look at, so that's your target. And then if you go over to exercises, you'll show, so how am I going to achieve that target goal? So working on heel to toe weight transfer. So having the athlete stationary work to heel to toe, and then actually get them to walk and emphasize heel to toe weight transfer. And then at the beginning of their rehab, if they have access to the pool, then getting them to do functional exercises, your squats, your calf raises, your side lunges, and then move on from there. So you'll be only moving on from the first phase once everything has been completed, and that will be a team effort. So you'll be this will be more therapy driven at the beginning, but even still, like later on, you'll check with the coaches and make sure, okay, are their rugby skills on par to move on to the next phase? Or are they compensating because they're not stepping through their pass or they're not punching through their pass? And then when you look at more towards, we'll go into phase 4, for example, you'll be looking at incorporating your running, your hopping, your jumping, and your landing, making sure, because this is an ankle injury, that they're properly absorbing the force, but they're properly landing equal left to right. Because sometimes with an ankle injury, you might be maybe landing more on the unaffected side just because you're not comfortable with the affected side yet. So making sure those compensations are occurring. Again, you'll be working into your bounding and any kind of change of position to get them comfortable from when they are returning to practice and sport, where they're reacting and not thinking of, okay, when I'm landing, I'm absorbing the load, I'm activating my glute, and then I'm going to push off. And then you'll look more again into phase 5, which will be more return to sport, and that'll be more rugby driven. And again, so change of direction, you'll maybe give them a visual or a verbal command. So you'll have them running forward, and then you tell them to drop down, come back up, go backwards, side shuffle left, drop down, and again. So they're reacting. So you can see if there are any compensations that they are still having. And then this is an example of a long-term injury. So this is going to be another shoulder reconstruction. So when an athlete does have a post-operative injury, we'll break down week by week. Again, this is aligning ourselves with the surgeon protocols, but also their guidelines. And this will break down all the rugby skills, all the conditioning, all of the weights, and their therapy goals. They'll also have milestones. So because this is a shoulder injury, you'll see week 5, they're gradually removing themselves from the sling. And then week 6, they'll fully remove themselves from the sling. And then at week 12, they should have full range of motion. So again, it's great for the athlete to have this, so they have goals that they can achieve, or they can see if they are on par for where they should be. This is where you'll work with the coaching staff, but also the athlete. For example, with the rugby skills, you really want to break it down, and then they can take it from there. So if you tell the athlete that you can only pass with your unaffected side, then they can work on that skill. And then, okay, at week 9, they can do pass catch progressions. How can we incorporate them? Maybe that's only into the warm up, because it's a very stationary skill, and then have the athlete perform the catch pass progressions off to the side of training, either with your other injured athletes or any medical staff. And then you can do pass catch progressions while walking. And then you'll move into, okay, you can now do that with jogging. So really breaking down the sport and showing how they can progress and give them something to do. So you're not essentially having them do the same skill for 4 weeks on. So you want to continue to keep them engaged. You want to give them something a little bit different each time. And then conditioning, again, at the beginning, because this is a shoulder injury, we'll look at biking and then progressing them to treadmill, walking. So you can even increase the height. So maybe they'll be walking uphill 1 week and then the other week downhill. You'll be jogging with your ball in your hand. So that way we're limiting your range of motion when you're jogging because it is a shoulder injury, and then progressing them to jogging with one hand on the ball. And then with weights, so your strength coach will actually provide the specific exercises, but this gives them guidance on, okay, so week 5, I know that I can only do seated lower body exercises. And then week 7, I can work on lower body exercises, but also the opposite limb. So again, it is important to still work the opposite limb just because you do see some weight transfer to the injured side. And then lastly is all your therapy goals at the side. Breaking it down, trying to be as specific as you can, but also not too much medical jargon that the athlete doesn't know what is expected of them. So increasing range of motion, then you'll progress them to weight-bearing exercises that are going to be on the wall, and then weight-bearing exercises that are kneeling, beginning overhead progressions, etc. So putting it all together, now that the plans have been created, you can identify how to integrate the athlete into your training plans. You want to work with the athlete prior to training to create their personalized plan. Create goals with the athlete to complete during team training and review the results with the athlete at the end of training. So for example, your goal should be objective and set with a standard. So you can maybe say, I'd like for you to hit the target 15 times this practice, or I want you to sink 20 free throw baskets this practice. So just giving them that tangible number so that they can work to achieve that. If the athlete cannot participate during a specific team drill, have the athlete complete a skill at the same time and duration of the drill. Again, so they're working up to building their conditioning, but also their overall training capacity so that when they do integrate back with the athletes, they're not behind. And then as well as have the athlete take the same rest with the team. So again, they're feeling like they're still part of the team, and they're building up that conditioning and that rest time. So managing loads when returning to train. So again, this is important because just because they may have fully recovered from their injury doesn't necessarily mean that they should be thrown in and doing everything that they weren't doing before. So again, progressing them and gradually putting them back into training and back into playing. So it's important to set training parameters to prevent re-injury or a new injury from occurring. So again, a lot of times when athletes are removed from sport for a long time and then they start again, they could have shin splints just because they're doing too much too soon. The athlete should have a gradual return to train and return to play. So return to train, you'll want to monitor the time of each sporting skill or activity. So maybe you're looking at the sets and the reps, or you're looking at the duration of a certain skill. So again, this could be maybe high speed running. And then return to play. You want to monitor the minutes, the number of events, and or the involvement of the sport. So maybe you're shortening your hockey shifts, for example, or you're limiting the number of events that a track athlete is engaging in. So maybe just 100 meters and not 100 meters and hurdles and team relay. Or with the involvement of sport, so say, for example, if it is rugby, noticing how much contact they are performing in. So if they're forward and there's a lot of scrums in that training session or that game, then you might want to consider maybe giving them a break or removing them for that day. Preparing for return to sport. So your physical, so your medical testing. So you're going to look at your strength testing, balance, mobility, and then maybe in testing like the structures of the actual injured tissue. Your performance and skill testing. So performance, for example, there'll be a single leg hop, your vertical jump height, your sprint time, comparing that to your baseline. And then the skill, talking with the coaches and making sure that their skill is at par as all the other healthy athletes, or maybe they need to continue to work on that skill before returning. And then your performance during training. So are they physically fit enough to keep up with everyone else? Psychological, mentally prepared to return. And then as well as that they have a greater understanding of maybe that there's new skills or sport plays that the team has been performing during their time off. So making sure that they're comfortable with those. Emotional, so making sure that they do have confidence in returning, as well as confidence in themselves in the sport itself. Making sure that they aren't too stressed or have anxiety of returning. And then looking at eagerness, because sometimes when injured athletes are over eager and they're trying to push you to return. So again, making sure that they have that appropriate level of eagerness. And then social, that they are feeling included within the team and as well as with the other staff. They do have the team support and encouragement for them returning, and then having their family and friends to support them as well, to provide them any kind of positive encouragement. And then again, depending on the level of sport, you may have an athletic therapist with you. So I'm just going to explain what the role of an athletic therapist is. So an athletic therapist is the link between athletes, coaching staff, parents, and other integrated support staff. So integrated support staff, for example, can be a doctor, a dietitian, strength and conditioning coach. So an athletic therapist will translate any medical injury and all the medical jargon into more practical, so that everyone has a better understanding in a practical and performance setting. An athletic therapist will put together a return to train and play plan, which are examples I've shown you previously, while working with the coaching staff, the strength coach, the surgeon, again, collaborating with all of those practitioners. And then ensuring that athletes are engaging in their modified training plans during team training. So again, you can only tell the athlete and the coaching staff so much of what they're restricted in, but having those eyes on training sessions allows you to make sure that the athlete isn't doing something that they aren't supposed to. And working with the athlete at the side of training for a specific skill. So for example, if they can't participate too much in the team training maybe at the early stages of the rehab, even just kicking the ball back and forth with the athlete, trying to engage in those, or maybe you're going to be timing the athlete on certain conditioning drills. So having that support with them on the side of training. And then as well as you're going to monitor the athlete's training loads when they're returning to play. So you're making sure they're not doing too much too soon. If you do have access to GPS data or a sports scientist, working with them, making sure that they aren't doing, they're not overloading. And then athletic therapists will assist in prevention of injury or re-injury. So again, with prevention, usually we'll do baseline testing. So that's concussion, but also any musculoskeletal or performance testing. You can provide the athletes your prehab exercises. So from those baseline testing, maybe you're finding out that an athlete has limited hip mobility. So providing them with that hip mobility so that they can increase their performance. And then as well as testing the athletes in those vulnerable positions so that the re-injury isn't occurring. An athletic therapist will provide preventative taping, again, for when athletes are returning to play maybe from an ankle injury, they'll provide them with the appropriate taping. And then lastly, ensuring the athlete is prepared physically so that the injury is fully rehabbed and the athlete is safe to return. Psychologically, that the athlete is mentally prepared and that when you're doing those tests in those vulnerable sporting positions, so for example, if it's a shoulder injury and you're testing the athlete in contact and making sure you're putting them into the same position as that they had previously re-injured, that they are comfortable and they aren't scared or apprehensive. Emotionally, again, that the athlete isn't scared to return or to re-injure. And then socially, being a huge support system. A lot of injured athletes will rely on their athletic therapists to be that person to lean on in that outlet. And then that's the end of my presentation. So I'll open up to any questions.
Thanks so much, Amy. That was great. So everyone, you can throw your questions in the chat for Amy, and I'll pull them out here. And I just want to say, yeah, I love the detail you went into here in sort of deep diving into this, and also the focus put on, getting the buy-in from the athlete and that sort of emotional and support piece. So I'll just ask a personal fun question here. What was some of the most challenging or maybe a unique sort of injury that you had to deal with, and sort of how did you approach it?
Okay.
We've all seen knee injuries. Did you get anything interesting?
Yes. Yeah. So last year, actually, I had a rugby athlete fully rupture their UCL of their elbow. So that's usually when most people have heard of the Tommy John surgery. So a lot of pitchers have this injury. Very uncommon with a contact athlete or, again, even a rugby athlete. So even when the athlete ended up having her surgery, even the surgeon had asked to use her as a case study and provide him with information and videos because he had never seen that before. And there essentially is not really much literature on returning an athlete back to contact from that kind of injury. So really having
coming from a non-contact sport.
Yeah, so I had to do a lot of research and again, like trial and error to see how to progress them. But I created that return to play plan prior to the athlete seeing their surgeon. So they brought that plan to their surgeon, and then the surgeon was able to give me feedback on maybe you should wait maybe another week before contact, or you can move up jogging to earlier. So that was definitely a big learning curve for myself.
That's interesting. I have a question here from Mike Miller. So with regards to sort of return to play after COVID-19, so we have a lot of people who haven't been really athletic in quite a while. He's saying, should we treat all of our athletes as though they were sort of returning to play from an injury, even though they're uninjured? Just thinking about that safety piece coming back.
Yes, definitely. And again, I think that a lot of sports organizations will be coming out with their return to train program specifically for their sport. Because again, a lot of athletes are going to be at different levels. So there may be some athletes that are doing a lot of home workouts or they're going for runs. And then there are athletes that maybe they're doing all their schooling online and their majority sitting down in front of their computer. So you're really going to have to start from kind of like that starting point, those simple exercises, and then progress them forward so that there isn't going to be injuries that are occurring.
That's a great answer. So thinking about that a little bit, so for coaches out there that don't have a full, support team, is there anything that they can do that's around this like baseline testing or trying to figure out where people are at on those different sort of benchmark levels? Thinking about this as, the athletes come back, like you said, some are going to have done a lot athletically, some are not.
Yeah, so I think that even like before training, maybe put a survey out there, kind of have a better understanding of where they're starting from.
Mm-hmm.
And then, I mean, it doesn't hurt to have everyone start at the basic, maybe stationary skills and making sure that they're doing proper warm-ups because they may not have done one for a very long time. And then kind of progress from there, and then maybe doing like a warm-up game, and then just seeing like how well the athletes are moving. Or are there some that you can really tell maybe haven't been doing any conditioning or just haven't been moving and not as mobile? So doing some just fun games, you might be able to identify those.
Yeah. So sort of starting slow and, letting your sort of intuition guide you there with some common sense pieces.
Yes, absolutely.
So I got a great question here, especially it relates to the sort of confidence and support piece from Tony here. What about recurring injuries? Saying where confidence is being lost by the team and the athlete.
Yeah, and again, that's a great question, and that's where your therapy staff will really kind of come into play, because if an athlete is constantly getting injured, maybe you're looking at some other factors, maybe sleep and recovery. So again, those can kind of come into play. Are the athletes engaging in warm up or cool down? Just trying to get it from a different lens, just to understand, or maybe the athlete has all these injuries because there's something deeper that's going on, or maybe they're disengaged in the sport and they're constantly sitting out because of that, or maybe there's some issues within the team. So just trying to dive a little bit deeper, just to understand why those injuries are constantly happening with that athlete.
Okay. A sort of a follow-up here from Al. Is there such thing as being injury prone? Is it coming from poor sort of, I wouldn't say conditioning, but maybe, prevention routines, or is it bad luck, or does it really exist?
Yeah, so there are a lot of athletes that will be hypermobile, and then on the flip side, have minimal mobility. So that's why those baseline testings are so important, so that you can provide these athletes with. So if they're really mobile, getting them to do a lot more strengthening and stability exercises, or if the athletes aren't mobile, then getting them to do those mobility exercises. So, but definitely, and even the type of athlete, if it's a contact or collision sport, and those athletes are just very aggressive, they're going to be probably injured a little bit more because they're just the way that they play.
Yeah, that makes a lot of sense. I love the progressions you did within the rugby chart there, sort of looking at the different stages of coming back and how those skills might fit into those different spaces. If I'm thinking about creating something like that for my own sport, of which we support 65 plus here in Ontario, how should I think about making something like that? Given that I'm not a professional, so I'm trying to figure out where to put things in the right boxes.
Yeah, for sure. And then again, like what I had mentioned is just trying to collaborate with others, but there are some sources online as well that will provide you with basic progressions, even if it's like return to running, and then you understand how to implement that into your own sport. Again, a lot of it is repetition. So just trying, because I've done these for a while now, but at the beginning, I didn't have them as refined as I did after just working on different programs. So just really practicing.
Right, exactly. Okay. And sort of a follow-up to that, I mean, a lot of coaches and teams out there won't have an athletic therapist on the team. But if someone does get an injury, that athlete might be going to some sort of physiotherapy, through the healthcare system or something else. Is there something a coach could give an athlete like that to ask the physio to get some of that information and bring it back? Is that something that makes sense? Or
yeah, for sure. If they were to provide the plan or create the plan on their own and have the athlete provide and to the external therapist, and they can approve, or maybe they can even write their own notes in there. As well as a lot of therapists will be open to emailing, and just because everyone's best interest is to have the athlete back to returning to play. So they'll be more than happy to kind of work together as well, providing their own expertise.
Yeah. Okay, and I have one final sort of question here. How do you react to situations if we sort of have parents who have a different idea of when an athlete should be coming back to sport? And I guess I'll open it up to say, it might not just be a parent, it might be sort of someone else on the coaching staff or whatever else, external pressures, right, outside of just the medical opinion there.
Yeah, for sure. And that happens all the time in sport. But a lot of times, if you do come prepared, again, making those plans or having the medical information in evidence, that way you can, I think a lot of it is just for them to understand, again, breaking down the skills and for them to know that you have to have these certain progressions to be able to move forward. So you can't just jump and run. You have to, again, learn to walk before we want to run. So just, I find that when you come prepared and you can explain everything, that they have a better understanding of where you're coming from. And again, you're not trying to be the bad guy and to have people removed from sport. You just want to make sure that you're putting them at their best interest.
Absolutely. Thank you. Okay, so a couple quick answers. Yes, as you can see in the chat there, some of the skills breakdowns and downloads are going to be part of the recording, which will be in the sessions tab in a few hours, possibly by tomorrow. So I hope to get those up within 24 hours. And I just want to say to everyone, the next session of the Ontario Coaches Conference takes place tonight at 7 p.m. It's with author and community builder and Humboldt Broncos bus crash survivor, Caleb Dahlgren. So be sure to check that out. As well, there's the networking tab on the left-hand side, as always. You can send private messages in there, start a video chat with anyone from this call, and start a group discussion. If you missed the past session with James Leaf, the recording has now been uploaded, and we encourage you to check that out. It can be found in the sessions tab on the left-hand side. Thank you all, and we'll see you all at the next session.